Hi everyone, welcome or welcome back to my channel. My name is Bipasha Rani. If you're new here, hi, my name is Bipasha. I am a nursing student and this is going to be my final semester, which I'm going to pass and I'm going to graduate and then pass the NCLEX, keeping spirits high. I'm making this video to reflect on how level 1, level 2 went, what things I learned, and what things I can do better. And I have notes from my instructors. I asked them, hi, how did I do, what critiques you can give me, you know. Nursing school, wow, I remember the day I got into the program and I remember how excited I was, and I remember just being so happy that I got into the program. If y'all don't know, I am in the LVN program. Don't know if I mentioned it. And most of my videos before nursing school were book talks, booktube, just book related. It's not I'm not going to do book. Well, it's not that I'm not going to do any book related stuff anymore. I will, but being in nursing school, it's kind of tight. You know, I have not been able to read as much as I would love to, but I'm still going to be making book content as well as nursing content. So we'll see how that turns out. Today is August 19 and it's a Tuesday. Classes start from Monday. We have a quiz on Monday. It's going to be very heavy because we do have 6 classes, plus they're going to nail us down with ATI, NCLEX preps, and all of that stuff. So that's interesting. It's going to be very interesting. Level 1 was something I wouldn't have expected because we did level 1 in the spring, we did level 2 in the summer, now we're doing level 3 in the fall. Before we joined, I joined nursing school, we were asked to go to a take charge workshop where the LVN faculty would talk to us about what they expect from us, what basically to prepare us for what's about to come. And we lost so many students in level 1 because of the 1 credit courses, and nobody would have expected the 1 credit courses to be so bad. And those were one of the most difficult courses I've taken, the 1 credit ones. I know it's crazy. Basic nursing skills was, I put so much effort into nutrition, human growth and development, gerontology, that I did not divide and conquer at all. My whole focus was passing the 1 credit courses, and I put so much effort into them that I was not satisfied with the grade I got for basic nursing skills. And then we had a foundation of nursing also, which was interesting. I liked that course. It was very nice. So it was just nice. That course was good. But also what I didn't expect was to get exposed to so many things clinical wise. Also, we started in long-term care, which eased us into the program, and then we had rehab the second half of the semester, and I learned so many hands-on things. Like, I learned hands-on deck kind of thing. If y'all don't know, I did not have any background beforehand. I had only probably 35 hours of internship in rheumatology and oncology together, so that's not many hours, and I didn't get exposed to a bunch of stuff. We were just talking theory based. They were walking me through IV tubings and all that stuff, and what to expect to do patient care wise. But mind you, those were clinics, so the patients didn't have to stay there for an extended period of time, unlike rehab and long-term care where they would just stay. That was their home for a certain time. Rehab is like acute care, so they would stay for 2 weeks, 3 weeks max. I've seen patients who were there for over a month, which I didn't expect. Long-term care is just that's their home. That's their home. So in rehab, I learned a lot of hands-on stuff. I understood how to be quick, and we also started giving meds in level 1. Here and there we would give some meds, but that was something that came unexpected to me because I have never done this. I had my hands all in. So level 1 was interesting. It went by. So many things happened in rehab. We learned so much. I learned so much. I've grown from the person. I remember being someone before nursing school and after nursing school. That time frame, this is August, so the past 8 months I have been in nursing school has been pure bliss. I wrapped level 1 good. We had 7 days off, but we were studying for our farm because in the beginning of level 2 we had competency, we had farm exam. Competencies, we had 5 skills in level 1. We had to perform all those 5 skills. They would select skills out of the 5, the surprises that we'd have to perform in 30 minutes. We had farm exam, and to think I would never remember these because I took pharmacology beforehand and I could never remember. I took the whole course in the summer. Last summer I took pharmacology and I could not remember anything. My focus was dosage, passing all the dosage exams because I could pass the exams barely, and I don't like when I barely pass. So thinking about now how I understand how meds work, how I remember them is diabolical because all of this thing could have always went over my head. Even though I am a nerd and bio love student, it was difficult to understand at times. So yeah, and so now me remembering meds, passing pharmacology and everything, or the pharm exam even in nursing school, it's very different. Giving meds is different. Level 2, our group was the only group who was actually in a med-surg unit. Everyone else were in a rehab setting, a fancier rehab setting than level 1. But only me, or my group, where we went, we were a proper med-surg floor in one of, I'd say one of the best hospitals here. But that didn't convince me to go into med-surg. I don't know, med-surg is not for me. So in level 1 I learned more hands-on stuff. In level 2 I was taught cluster care and critical thinking. In level 1 my instructor was like, okay, you need to know the meds like that, you need to say it out like that. In level 2 the instructor wanted me to go, a little slowly, just take your time. He always would say that do not treat meds as an academic one. It has to be, you have to be slow while giving meds. Where in level 1 I was like, you need to know this, get in, out. So that was a little out of whack because level 1 I was taught to be fast. Level 2 I'm supposed to be fast but slow at the same time. So that was different. And then everything else was just, it was interesting. Med-surg was interesting. In level 2 we had 3 rotations. We had our main med-surg rotation, we had community, which I went to DaVita Dialysis. I loved that place. The whole dialysis process is such an important process, and it's such an intriguing process. Like, you're sitting there, and you have tubes going in your body, filtering the blood and bringing the blood back to your body from the dialyzer and all the dialysate, and just interacting with them on a daily basis and seeing how they are. It was nice. It was really nice. Like, I level 2 didn't feel like level 2 because it was like 11 weeks and we were done before we even knew, or we were done before we even started anything. So we had med-surg rotation on the med-surg unit, an actual med-surg unit. We had community dialysis, and we had a psych rotation. Psych rotation was only for like 2 days, and let's say it was interesting to say the least, both the times, because both the times we were somewhere else. If I remember correctly, we were in, and I did my recovery rotation the very first day clinical started, so I do not remember. We had inpatient and outpatient. I'm trying to remember. I went to inpatient first, and then we had outpatient. We had that, and then we had we had outpatient first, and then we had inpatient because we had two different places we had to go to. So we had those 3 rotations, and then we had a mental health course that went with the psych rotation, and we had med-surg 1, medical surgical nursing 1. I could have done better. I keep saying I could have done better, but I don't like to give excuses, but that is true. Level 1, I put all my concentration into one credit courses. Level 2 also, I put so much into the mental health. Like, I would take the exams way because we have a new setup of how our courses are shown. Being a community college, we use Blackboard Ultra now, and you can go, you finish A to Z, and then you can take the exam. Literally, you can take the exam, and it's on respondents. I would take the exam being half prepared because mental health was weighing on my mental health so much. I don't know what it is about these 1 credit courses that just I cannot do a 1 credit course. That is absolutely difficult for me to even wrap my head around, because the intensity of these courses are not 1 credit course. I don't know what it is about these courses I cannot do. Med-surg, I'm telling, level 1 basic nursing skills was easy. Med-surg level 2 med-surg was easy. So I do not, it's just, I was so close to getting what I wanted, but missed by a hair. It's okay. Pass is a pass. So in level 2, we did everything like med-surg would do, We had codes, which was interesting. We had so many patients. It felt like we were in the ER, basically. It's weird. I felt like I was in the ER. We had admissions every day, which is a random med-surg floor, but I have seen too much in the med-surg floor, and I am not built for med-surg. I can do everything. I have seen the worst wounds, the worst patients, and I've learned a lot from the med-surg, but I don't want to do med-surg. I don't know. I've always wanted to do oncology. This is my true thoughts. on this are my true thoughts on how the nursing school is going. I love being in nursing school, and I'm going to finish it because I started it. And I am going to be a capable, competent, and compassionate nurse. 6 C's. You know what I'm talking about. So, what I expect from myself in level 3 is to finish competency form on the first tries, because in level 2 I had to take 2 tries, and I want to finish form and competency on the first try. We have a quiz on day 1. I want to pass that quiz on the first try. She gave us PowerPoints and I made notes. I learned how to minimize my study guide because my study guide was literally 40 pages long and I was doing no studying. So this brings me to a recap of everything we've said so far in 16 minutes. Level 1, I learned hands-on experience, hands-on patient care, and techniques, remembering ranges. Level 2, we did more critical care thinking, and we did cluster care with complex patients. Level 3, I do not know what to expect yet because we have had nothing they told us about. It's just from from a couple of students from level 3 who graduated. Yay them. We're gonna be there in 16 weeks. It's crazy. So this brings me to the second part of the video, which is how do I actually study for nursing school? The best techniques for me to learn in nursing school, and let me tell you, everything I'm gonna say came from a first-hand basis for me, because what I mean by first-hand basis is this is a lot of trial and error. You have to figure out what works for you. Me, by the time I figure it out, the semester is over. So you have to figure it out. You know, what worked in AP won't work in metallurgy. What worked in farm or micro will not work in skills or any other course. How I do it, we have PowerPoints, okay? We have notes underneath them. This is what I used to do. I used to take all the footnotes, put it in a Word document that's 40 pages long, and then I would answer the course objectives. Do not do that. Do not do that. Take your course objectives, put all of them in a Word document. We have course objectives that's like literally 6-7 columns long. Well, 4 or 5 columns long. And then that's the course objectives that they want us to demonstrate. The actual course objectives are usually in the center that have questions like discuss the difference between isotonic, hypertonic, and hypotonic solutions with examples. Those, I highlight those, copy them, and put them in a new Word document. Go through my slides and answer those questions first before I even look at the slides. Answer those questions from the course objectives, and then go over the PowerPoint to see what I've missed, what more needs to be done, and print it out. I don't know why. I have iPads, but I still like a printed document. And then I listen to the lecture video and I make notes of extra stuff she's saying. That way, this is my study guide. Ever since I've started this, I have made nothing less than an 85 on the exam. So whenever I do this method, 85 is an automatic. And if you start reviewing all the material from beforehand, life will be so much easier. This brings me to my second tip. Do not rely on your last exam replacing your lowest grade. You might as well don't not think about that at all. That's a comprehensive. There are more chances of losing points than gaining them because the material is so old. In your head, it's catching spiderwebs. Number 3, even if the low your final does end up replacing your lowest, that won't change your letter grade. So what to do is nail down the first 2 exams and the first 3 quizzes. You're good to go. I remember in skills, my first exam was a 63, and then I started getting good grades. I got 78, which is barely passing. That's not a good grade, and then I got 85, and my grades kept improving, like going up like that. And my final did end up replacing my lowest grade, but because my lowest was a 63, what Blackboard does, and I hate it, is the first exam literally weighs you down. Like, it literally weighs you down. It's very difficult to come out from that fall. That's a very big fall. That's a very heavy fall. You cannot come up from that. So what you do is you have to nail the first 2 exams down. That way you'll have cushion to fall on. And I am trying so hard to nail the first 2 exams down because I have 6 courses and I have only one 4-credit course. I have to nail the first 2 exams down because there's no other way I can do anything else, because this is the first 2 units, like literally the first 2 units or chapters. We have IV because in level 3 we're finally going to be doing IV, and neuro. So as for us, we could not administer meds through IV also, even during clinicals. We cannot flush the line, we cannot strip the lines, cannot do any of that sort. So we're doing IV this semester, and with us doing IV, there's so much to know, because you thought that medications just... No, that's not how it works. And I was watching The Resident last night with my siblings, and if you've watched The Resident, So this is my study guide, and I'm gonna make this my holy grail because and out of context, on Thursday I have my TEAS exam, so I have to study for that too. Wish me luck. I know I had to write a TEAS exam for the LVN school, but I'm redoing it for the RN school. Please, I want to pass. I will pass. Only one thing on my mind all the time, that whenever I'm writing these exams, it's literally assessing how well I can do patient care, how well I can take care of my patients, because at the end of the day, it's for them. So I have to understand all of this material and not just try to memorize them. So making study guides, doing active recall is very important in nursing school. You cannot sleep on an idea. You are not allowed to sleep on an idea in no way, shape, or form. You have to keep going over the same materials. Like, go back to level 1 and remember what the vital signs ranges are, what the lab ranges are, what's the difference between a focused assessment and a head to toe assessment, how do you place a catheter, why do you place a catheter. You have to go back to level 1. I go back to level 1 to my notes and look through them and memorize them. I have flashcards, and just reviewing them helps to keep the mindset going. Like, hello. Nursing school is overwhelming. This video has been all over the place, and my thoughts are in a jumble mess, because why would it not be? We've had 2 weeks of holiday. Well, 3 weeks, because the first week was just stress because our grades didn't come online yet. So we wrote our last exam on Monday, and then practically the whole week was off. And then last week was the official first week off. This week's our last week off. And to say the least, this has been a great journey. Nursing school has been great. I love how much I've changed as a person, how much I am capable of becoming a nurse, how I think. I know how to arrange my thoughts. I know how to arrange concepts. I know how to assess. I know how to cluster care. I can multitask, which you'll be shocked most nurses cannot do, and you'll be shocked by the stories I've seen or experienced in the med-surg floor, because at the end of the day, it's not all black and white. I wish it was, but I have seen so much. It's bonkers, like, to think. So there was this one patient I had who had this big wound, such a big wound, and I was helping with wound care. I was going around with wound care and be like, hey, can we look at this patient, can we look at that patient, help, and stuff like that. And that made me realize that looking at wounds is not the problem. I can see the biggest wounds and I'll be fine. So I have seen a lot, and I have great stories from med-surg floor. I hope I can make more memories. I have so many pictures, and it's just, life's good. It's treating me good in nursing school, at least. I have nothing else for y'all. Like, that's all I have. If y'all have questions, don't hesitate to comment. I read them if they are even there. Again, I don't expect anyone watching this at all, so this is me being real. And if the future me is watching, I know you made it, because I made it. So I know you made it. You're just watching this for the giggles of it. And yeah, I do look pretty. So that's my name, by the way. Nothing funny, it's just my name. But yeah, that was level 1 and 2 of Albion in 30 minutes. and I cannot wait to share level 3 with y'all. I'm gonna try to make more interactive videos, but most of it's gonna be study with me because that's what nursing school is about. Study with me. Before I go, to-do list of the day is prep for the ATI, prep for the pharm exam, and the quiz on Monday. Competencies, I'll be fine for competency. That's not a big deal. But bye. I'll see you all around somewhere else.